Good afternoon, everybody. Welcome to our next anatomy lecture. I'm a little bit froggy in my throat because I'm getting over a cold, but hopefully it won't affect things too much. Waiting for some folks to show up. Okay, we don't have anyone yet, but I'm going to go ahead and get started and add people as they show up. And hopefully we'll have a few people come to the lecture. If not, no big deal. Okay, we're starting with chapter 6, which is cartilage and bone. So let's get that going. Okay, chapter 6 is cartilage and bone tissues. Let's talk about the skeletal system a little bit. It's composed of dynamic living tissues. What does that mean? It means that your skeleton isn't static, it's constantly changing. Someone just came in. Hello and welcome to the lecture. Are you there? Can you hear me okay? Whoever came in.
Is it pretty good?
Kiara, I can't hear you. Anyway, okay, let's keep going. Kiara's with us. All right. What I was talking about, dynamic living tissues that your bone constantly remodels. It's not a static structure that is constantly being added to and removed from to add calcium to your blood. We'll talk a little bit more about that later. It interacts with all the other
But it
organ
doesn't even
systems.
work with this.
Kiara, was that a question for me?
Oh shoot, I'm so sorry.
Yeah, you got to mute yourself if you're going to talk to somebody else. All right. Continuing rebuilds and remodels itself. So there's constantly cells that are chewing away at your bone to remove the older, more brittle bone, and new cells are adding bone every day, especially if you're active. Includes the bones of the skeleton as well as cartilage, ligaments, and other connective tissues that stabilize or connect the bones. So please note the skeletal system is not just the bones, it's these other things as well. The main job is to support our weight. It interacts with muscles to produce movements. Muscles pull on bones, and that moves our bodies, permits us to do these activities. Okay, what are the main functions of cartilage? Well, it supports soft tissue. But even more important is provide a gliding surface at articulations or joints where two bones meet. Most common is hyaline cartilage at the skeletal uh, junctures or joints in your body. Now, there is some different kind of cartilage that is found in the pubic symphysis and intervertebral discs. That's fibrocartilage, but primarily it's hyaline cartilage, and this is what protects the ends of your bones from being destroyed. And when you have osteoarthritis, this material gets worn away or improperly formed. It provides a model for the formation of most of the bones in the body. I don't know if you guys know, but when we were a little teeny tiny inside of our mother's womb, we didn't have a skeleton made out of bone. It was made out of cartilage. And then the bone replaced that cartilaginous model, which is a good indication of our evolutionary heritage as very distantly related to cartilaginous fish. Okay, what are some different types of cartilage? There's hyaline cartilage. As I said, this is most commonly at the joints, in your ribs, places like that. Fibrocartilage is found in the intervertebral discs of your back and your pubic symphysis and your pelvis. And elastic cartilage is found in your ear, nose, and vocal cords, as well as the epiglottis. Hyaline cartilage is the most common or abundant type. You find it in the trachea, which is your windpipe. This is what allows your trachea to be flexible but holds open against the negative pressure. Larynx, which is your Adam's apple, the articular joint surfaces, and the epiphyseal plates. These are the plates between the center of bones and the ends of bones while we're still growing as children. It gives flexible support with cushioning and surrounded by a connective tissue called covering called the perichondrium. If you remember last time we talked about the periosteum, similar, but it's even slower to heal. Believe it or not, hyaline cartilage is one of the slowest tissues in the body to heal. And here we go, got another person in. So now we have two people. Wonderful. So very slow healing because there's very few stem cells there. So often, if you get hyaline cartilage damage, they have to remove it and put it in something in its place. Okay, fibrocartilage. This type of cartilage has an extracellular matrix with numerous collagen fibers. If you remember, collagen fibers are kind of like metallic cables, very tough, strong. Resist stretching and compression. So this is super important in your intervertebral discs. All the weight of your body comes down on your intervertebral discs of your spine or backbone, and these discs work very similar to, I don't know if you guys have ever been on the freeway and looked over at a truck, one of those big 18-wheelers. And if you look underneath the cab, sometimes there's these black rubbery things that are holding the cab up. And as the cab bounces up and down on the road, you see these black rubbery donuts squishing and absorbing the weight. If you've ever noticed that, it's very similar to how our intervertebral discs are set up. They do have a center, which is gel, called the nucleus pulposus, and it reinforces it in such a way that it gives really flexible but strong cushioning between those vertebrae. It acts as a shock absorber between the vertebrae and the knee, and between the pubic bones. We also find it in the joint of your knee. Again, another place with a lot of force coming down, and you need really, really strong and flexible support. Now, this one lacks a perichondrium, which means it's even slower to heal. So this fibrocartilage, often if you get serious damage, for example, if you get an intervertebral disc that's badly damaged, they'll just remove it and fuse those two vertebrae because it takes so long to heal. Fibrocartilage takes years to heal if it's ever going to. Elastic cartilage. The matrix contains highly branched elastic fibers. This is what allows your ears to be flexible. You ever wondered why you need flexible ears? Well, it turns out a lot of people sleep on their side. If they slept on their side and your ear wasn't flexible, it would break. So one of the reasons. You find it in the external ear or pinna and the epiglottis, which covers the glottis, which regulates air or food going through your throat. Needed where very flexible support is needed, and the tip of your nose as well. Okay, this is a nice picture or figure showing the different types of cartilage in their various areas. Growth patterns of cartilage. Well, the first is called interstitial growth, and this is growth from within. So instead of the edge, it's in the center. Chondrocytes, which are cartilaginous cells, undergo mitosis. That's cell division. Now there's two cells in a single space called the lacuna. As the new cells secrete matrix, they kind of push each other apart. They're now pushed apart, and each has its now own lacuna, and growth has occurred from the center of the cartilage. The other kind of cartilaginous growth is called appositional growth, which is growth on the edge. Stem cells inside the perichondrium divide into what are called chondroblasts. So chondro means cartilage, blast means build. So these are cartilage building cells. The new chondrocytes produce the matrix around themselves, becoming chondrocytes in the lacuna. So instead of it being in the center, they just kind of cover themselves with matrix, adding thickness from the edge. So this shows you interstitial growth, and this shows you apposition. Talking about bone now. What is bone for? Well, bones are composed of all tissue types. There's muscle, not much, but all different types of tissue make up bones. The primary component is osseous connective tissue, what we call bone. The matrix is sturdy and rigid due to calcification or mineralization. The calcification means to put calcium into something. Mineralization means putting minerals into something. It's for support and protection. Bones provide structural support and serve as a framework for the entire body. Now, I think we have two people in the lecture with me. If you guys want to unmute and ask a question, that'd be it's fine. Feel free to do that anytime during lecture. You don't have to wait till the end. Bones also protect many delicate tissues from organs and from injury and trauma. Makes sense. Movement. Well, bones are important for movement. Muscles attached to the bones of our skeleton contract and exert a pull on the skeleton, which then functions as a series of levers. So the reason why we move is that muscles pull on bones, bones pull on all the rest of our body parts, and that's how we move. Hemopoiesis. Please note the roots of this. Hemo is blood. Poiesis means to generate. So this is the generation of blood. It's blood cell production in red bone marrow. Now there's two kinds of bone marrow, yellow bone marrow and red bone marrow. If you've ever cut open a bone, say from an animal, you notice there's a red area and a yellow area. The red area is red bone marrow, often found at the ends of long bones and in other types of non-long bones. And the yellow bone marrow is fat, found in the marrow cavity or medullary cavity of long bones. Red bone marrow contains stem cells that form all the blood cell types. So it turns out red bone marrow is the most important for making blood. Storage of mineral and energy reserves. More than 90% of the body's reserves of minerals, calcium and phosphate, are stored and released by the bone. Now, please remember, your body needs calcium and phosphate to do other physiological processes. If you don't get it in your diet, your body will steal from your bone to do those things, such as nerve impulses, blood clotting. So that's why it's important to maintain calcium and phosphorus in our diet. Calcium is an essential mineral for such body functions as muscle contraction, blood clotting, and nerve impulse transmission. So calcium is not just for bones and teeth, it's for physiological processes. Phosphate is needed for ATP utilization. The P there is phosphate, and phospholipid production, among other things. Classification of bone by shape. Now, here's an interesting thing. You look at the bones of the palm of your hand, they don't seem very long, do they? It turns out they are called long bones because whether or not it's long bone, a short bone, or a regular bone doesn't have to do with its overall length, its length to width ratio. So even if you look at a finger bone or a wrist or a palm bone, they're not really long, but they're much longer than they are wide. They're set up kind of like a stick or a column. And so that's why they're called long bones, even if they're not really that long. They possess an epiphysis and a diaphysis shaft. So there's usually two epiphyses, one on either end, and the shaft in the middle. You find this primarily in the appendicular skeleton, which is arms and legs. Short bones have equal length and width. These are approximately cube-shaped. We find them most often in the wrists and ankles. Flat bones aren't always completely flat. As a matter of fact, many flat bones are curved. So they're flat because of the way that the bone is composed. So it doesn't mean it would sit flat on a table. It just means it's got a broad sheet of bone with material in between. Extensive surfaces for muscle attachment. You find it in the skull, especially the top of your skull, the shoulder blade, the flat part of your shoulder blade, and chest bones, the bones right in the center of your chest. Now, irregular are the other ones. They're complex shapes found primarily in the vertebrae and skull. If you ever look at the bones of the skull, there's a lot of very unusually shaped bones, especially the scaphoid. Really bizarre shape, and that's why it's called irregular. Okay, so there's a flat bone. Even though it's curved, it's flat because of the fact that it's thin and it doesn't fall into any of the others. There's a long bone, a short bone there in the feet, and an irregular bone in your vertebrae. Best place to find irregular bones, by the way, is in your skull. Let's talk about long bone structure. The diaphysis or center shaft of the long bone contains the medullary or marrow cavity. That's where fat is stored. The epiphysis contains spongy bone where there would be red bone marrow and bone production. Metaphysis is the area of growth between the diaphysis and the epiphysis. That's the gap right in between the center and the ends if you're a child. It disappears after maturity when growth stops. So it's not the same for everybody. It's not a particular age. But as soon as you stop getting taller, that's how you know the metaphysis has disappeared and turned into the epiphyseal line rather than the epiphysis. Metaphysis. Okay, more about long bones. There's hyaline cartilage on the ends for shock absorption. You have the medullary or marrow cavity contains bone marrow. That's usually fat. The endosteum is an inner lining, which is similar to the periosteum, but lines the inside of the bone. Remember, the bone is hollow. So the inside of that bone, where that medullary cavity and marrow is, would have this endosteum lining. And the periosteum, I've mentioned, it's a fibrous cover of bone, which allows blood vessels into the bone, assists with repair. This is the most important job, by the way, assists with repair and prevents organs from damaging contact with bone. Okay, I got to mention something really quick. It doesn't have anything directly to do with this, but if you're listening, it will really help you with my tests. Please note that when a choice is offered, and this, I think, came in your welcome email, if you guys got that, was beware of a couple of choices on my test. First, none of the above are true. Those are rarely the right answer because usually the right answer is there. The only time none of these answers are correct is right is if there's nothing even close. So if there's something really similar to what you would normally put, go ahead and pick that because none of the above is rarely right. But the opposite of that is all of these answers are correct. Now, I'm asking for you not just to regurgitate something familiar, but to come up with a little bit of critical thinking. I'm looking for the best answer, not just a right answer. It's not set up that way. I want you to think. So when you see that choice, all of these answers are correct. You have to ask yourself, do these other choices seem logical or fair? Now, I don't put those in very often when they're not right. The only time that that's not the right answer is if the answers themselves are all opposite from each other. If you say, well, I studied one of them, the other one seemed logical, but it wasn't directly in the notes, so I'm not going to put that, then you're going to lose points. So if I were you, I would pick all of these answers are correct whenever it's offered, unless you're 100% sure that that's the wrong answer. So when you see that choice offered, if it was me, I just go ahead and pick it. Most people lose points because they find something familiar in the notes and then they just bypass all of these answers are correct. Don't do that. Okay. Pick that when it's offered and your score will go up. And then I don't have to go into a email battle with someone about what all of these answers are correct means. Okay. So hopefully that helps. All right, so this is what a long bone looks like when it's cut open and all the living cells are gone. You see the medullary cavity in the center. Here at the end is where the spongy bone is, and the red bone marrow. This is where bone cell production would occur. You see blood vessels. Blood vessels penetrate this end area with the spongy bone. So that
No.
Gary, you gotta mute yourself if you got stuff noise in the background. These
Sorry.
blood vessels are there, no worries. Uh, so that they can be in contact with these bone marrow cells and can be producing bone. Excuse me, blood cells. Okay, so when we look at the periosteum a little bit more closely, you see that these perforating fibers burrow into the bone, holding it tightly adhered to the surface. You see these osteocytes, which are living bone cells. And then you can also see these different kinds of cells. The osteoclast, C for class and C for chewing. Think of them as ones that chew away old bone. And then the osteoblasts are these little ones here. These are what are building new bone. So it's chewing away the old and building new. Osteoblasts to build, osteoclasts to chew. I hope my voice can hold up. I woke up sick today, so it may be the case that if I can't finish this, you guys will find PowerPoints put up. But I'm going to go as long as I can today. All right, four types of bone cells. Osteoprogenitor cells are stem cells that can divide into other kinds of cells. Osteoblasts, as I said, these are the builders of new bone. Osteocytes are mature bone cells that are neither building, chewing, they're just kind of sitting in the bone, maintaining it. And then osteoclasts are involved in bone reabsorption, the chewing away of old bone to release calcium into the blood, also to remove old cracked bone tissue. And this shows you how osteoprogenitor cells or stem cells turn into an osteoblast, which makes bone. They form the bone around themselves. So once they're fully embedded in the bone, they look like this, an osteocyte completely embedded in bone. And I always like to think of it as like a squid in cement. So they look kind of squiddy, and the cement is the bone. Okay. This shows you how the periosteum is on both sides because the inside of your skull is not the inside of the bone. Okay. The inside of the bone is the spongy bone. So there's a periosteum both on the outer layer of the skull and inner layer. The endosteum would be in here covering the spongy bone. Flat bones within the skull. Those are two layers of compact bone with a region of spongy bone sandwiched between them, as I showed you in the picture. Both layers of compact bone are covered by periosteum, inner and outer. Okay, this shows you the osteon system of long bones, or more or less long bones. Each one looks kind of like a series of tree rings. You can see each of the osteons has the collagen fibers moving in opposite direction, and that works very much like plywood. I don't know if you guys know how plywood is set up. You find a layer of wood that has grain like this, and then on top of it, one going the opposite direction, and then it reverses back and forth, and that makes the plywood extra strong. So by having alternating directions of the collagen fibers, it makes these osteon systems like little tree trunks super strong. And within the center, you find two blood vessels and a nerve. This shows it in even greater magnification. You see the collagen fibers going opposite directions. You see osteocytes buried inside the bone, nerve, artery, and vein. Okay, this is spongy bone, showing you osteoclasts and osteocytes or osteoblasts. Okay, this is what it looks like under a scanning electron microscope, and this is what it looks like under a regular light microscope. All right, here's spongy bone. All right, let's talk about ossification. It's the process of turning an infant's cartilaginous skeleton into bone. It begins in the embryo and continues as the skeleton grows during childhood and adolescence. Even after adult bones have formed, ossification continues. So we're constantly chewing away old bone and replacing with new bone as our old bone becomes more brittle, fractured. By the 8th through 12th weeks of embryonic development, the skeleton begins forming from either thickened condensations of mesenchyme, which is a tissue found in fetus, or a hyaline cartilage model of bone. This is the most common. The hyaline cartilage model forms, and then the bone replaces the cartilage with bone. These models are then replaced by hard bone. Okay, let's talk about different types of ossification. First is called intramembranous ossification. It produces the flat bones of the skull, some of the facial bones, such as the zygomatic and maxilla. Zygomatic is cheek, maxilla is upper, well, cheek, and then upper lip area, front of your cheek. The mandible, lower jaw, and the central part of your collarbone. It begins when mesenchyme becomes thickened and condensed with a dense supply of blood capillaries and continues in several steps. This is not the most common way. This shows you these steps. I'll let you take a look at them. Shows you kind of how this works. Okay, endochondral is the one I'm going to spend the most time talking about. Begins with a hyaline cartilage model. So we start off with a full skeleton of hyaline cartilage. We don't start with bone. And then what happens is your body chews away at the hyaline cartilage and replaces all that cartilage with bone. So these are the bones that are formed from endochondral. Endo means inside, chondral means cartilage. So here's your hyaline cartilage model. You can see it darkens as the body starts putting calcium in. So the darkened hyaline cartilage means it's been calcified, but not ossified. Ossified does not just mean having calcium. It means being turned into proper bone. So here you can see calcification in the beginning of ossification. And here you can see this whole center is beginning to be fully ossified. And yet at the ends, calcified here, and just hyaline cartilage out of the tips. And then you can see as we get older and older, this area where the cells are actually proliferating, growing, going through mitosis gets thinner and thinner as we get taller and taller. So this is what is called the epiphyseal plate, the plate space where we're getting taller. We get taller from here and here. So as soon as you stop getting taller, this epiphyseal plate becomes the epiphyseal line. And that's how you know where the ends in the center of the bone fuse together at your maturity. And generally, maturity is, I define maturity as when you stop getting taller. There are other different levels of maturity, ways to measure it. But for me, if you're not getting any taller, you're biologically mature. Okay, endochondral ossification of a long bone occurs in progressive stages. I showed you that in the previous image. Bone growth is complete when each epiphyseal plate has ossified and the epiphyseal line is formed. Depending on the bone, epiphyseal plate ossification occurs between ages of 10 and 25 years. So some people stop growing very young, especially women tend to reach maximum height earlier than men. Some men continue to get taller all the way up through age 25. And it could be some women at 25 and some men at 10. But as you guys know, women tend to mature more quickly than males do. Bone remodeling. Although adult bone size has been reached, the bone continues to reshape itself throughout a person's lifetime in constant process of bone reabsorption, that's from the clasts, and deposition from the blasts. Now, this can be accelerated. New bone can be accelerated by rigorous exercise, especially impact exercise, jogging, sports like rugby, things like that. I don't want to play rugby at my age, but there's things that we can do to make our bones be healthy. It's not just about eating calcium. It's about activity, stressful activity on the skeleton. Okay, this shows you the different layers of the epiphyseal plate, ossification, calcified cartilage, proliferating cartilage, this is mitosis, and resting cartilage. And you find that in that space between the ends and the center of the long bones. More about bone growth. Interstitial growth occurs in the epiphyseal plate as chondrocytes undergo mitosis, that's cell division. Appositional growth occurs within the periosteum. We're not going to click on this link. More about bone remodeling. The continual deposition of new bone tissue and the removal or reabsorption of old bone tissue. The removal helps maintain calcium and phosphate levels in the body fluids and can be stimulated by stress on a bone. So your bones become weak when you're constantly drawing calcium out and not replacing it. And that's often what happens with older women it is called osteoporosis. It's more pronounced in women, partly because after menopause, the sex hormones drop off precipitously, and in males, it's much more gradual decline. So osteoporosis tends to affect women at younger ages than men. Blood supply. Bone is highly vascularized, meaning having blood vessels, especially in regions containing red bone marrow. Blood vessels enter the bones from the periosteum. The nutrient artery and nutrient veins supply the diaphysis, which is the center of a long bone. Hormones. What effect do hormones have? Well, hormones can control and regulate growth patterns in bone by altering the rates of both osteoblast and osteoclast activity. Osteoblast activity is going really, really fast when you're an infant and a young child. And the osteoclast is going to be increasing as you decrease your calcium absorption. Growth hormone, or human growth hormone, HGH, affects bone growth by stimulating the formation of another hormone called somatomedins, which are produced in the liver. I'm going to talk about how HGH and somatomedins work together in my physiology class, if you take that. Somatomedins directly stimulate the growth of cartilage, the epiphyseal plate, helps you getting taller. Thyroid hormone stimulates bone growth, comes from your thyroid gland, which is right here. Growth hormone and thyroid hormone regulate and maintain normal activity at the epiphyseal plates until puberty. Puberty is generally considered the end of it, is when you stop being taller. Calcitonin inhibits osteoclast activity. So what does that mean? Well, remember, osteoclasts are chewing away, releasing calcium. Calcitonin means it's a hormone that tells your body, hey, we have plenty of calcium. You don't need to chew away the bone to release calcium into the blood. So calcitonin means we have plenty in our diet. Don't chew away at the bone to release it. They're showing you some more anatomy of the long bone. Okay, so these are some structures that you would find in bones: sinuses, processes, foramens, or holes. I'll let you take a look at that. This would be much more important if you were taking this class live with me on campus, but it will come up in visible body, so check that out. These are showing you the anatomical terms and their descriptions. These are things you should know, so take some time to learn these. Okay, that was 6. So let's go on now to 7. Kiara or Kimberly, do you have any questions before we move on to the next chapter?
So if you don't get enough calcium in your diet, your body will eat away at your bones,
That's right.
or
Yeah, that's why people get osteoporosis. It tends to happen in older folks as their sex hormones diminish. If you're a young person, you're probably not going to get it because you're active, sex hormones are going crazy, telling your bones to store calcium. But as we get older, we don't need as much calcium, we don't move around as much, and we don't get as much sunlight, because we're afraid of, skin cancer. So the absence of sunlight, reducing vitamin D, that lack of vitamin D means you're not absorbing the calcium that's in your food. Lack of calcium means that your body says, hey, I still need calcium for muscle contraction, blood clotting, etc. So it steals from the bone, giving it to the physiological processes, and that's called osteoporosis.
okay, so going outside is a good thing.
Yes, I mean,
Okay.
look, we talked about having too much uh, ultraviolet light, right? When we were talking about the
Yeah.
skin. And what most people still think is it's about skin cancer, and it's not. It's about folate, right? Your folate's destroyed, you can't reproduce successfully. So you want to make sure you get enough vitamin D so that by sunlight to make vitamin D to absorb calcium, but not so much that it destroys the folate in our bodies. And our skin color really affects that, because if you have dark skin, you need more sunlight to get that same vitamin D. If you have pale skin, you need much less. And that's why people whose ancestors are from northern climates tend to have pale skin. The sun's less intense. People with ancestors from equatorial areas tend to have darker skin because the sun's much more intense. So you guys remember that whole essay. So there you go.
Yes.
It's all connected. It's kind of
Thank you.
You're welcome. Glad you like it. All right, onward and upward. Chapter 7, axial skeleton. Here we go. Yeah, the axial skeleton. Bones of the skeleton form an internal framework to support soft tissues, protect vital organs, bear the body's weight, help us move. Typically, there are 206 bones in the adult skeleton, although this number varies in some individuals. Now, it varies primarily having to do with what are called wormian bones. They're actually bones in your skull that don't have names, that are kind of random. If you were in class with me, campus, I could show them to you. We might see that. I can show you later on when I show you images from the text. Larger numbers of bones are present at birth, but the total number decreases with growth and maturity as separate bones fuse. Now, this is kind of like a riddle. Why do little kids have more bones than adults? We remember, let's say, for example, our femur, upper leg bone. The center is called the diaphysis. The epiphyses are on the ends as caps. When you're 5 years old, those aren't fused together. If you died and were buried, they would find that bone in three pieces. There'd be the center and the two ends. But if you die as an adult, those ends fuse, forming a single bone. So that's why babies, children have more bones than adults, because all the long bones are made up of three instead of one. Hopefully that helps. A little fun factoid you can take with you to your family. All right, the axial skeleton is composed of the bones of the central axis of the body. So think of skull, vertebrae, ribs, but not pelvis. So we're not going for the pelvis or legs, not going for the anything associated with the shoulder. So the idea is if any bone touches an arm or leg bone, or is an arm or leg bone, it's part of the appendicular skeleton. Another way to think of it is what bones does a snake have? Snakes are all axial skeleton. They have no appendicular skeleton. So it's just in the center. So axial means along the center axis, and appendicular as an appendage means added on. To add on is to add an appendage, and appendages are arms and legs, and the girdles that are associated with them. When we say girdles, we mean pelvis and shoulder bones. Okay, so here's your axial skeleton. You can see it's everything that's not paled out: skull, vertebrae, ribs, sternum, sacrum, and coccyx. Notice that the pelvis is not included because it touches the legs. And the scapula and clavicle are not included because they touch the arms. There's the posterior view of the axial skeleton. The skull, cranial bones form the rounded cranium, which completely surrounds and encloses the brain. Facial bones form the bones of the face. They also protect the entrances to the digestive and respiratory systems, as well as providing attachment sites for facial muscles. Mandible, or lower jaw. The prominent chin of the mandible is called the mental protuberance. I always tell my students, remember to think about it. I got to remember. How am I going to remember this? I've got to be mental. So whenever you touch your chin, to remember that you're mental. Everything associated with the tip of your chin is called mental, not having to do with being mental. All right, cavities of the skull. The largest cavity is the cranial cavity, which has the brain. Smaller cavities include the eye sockets, the mouth, which is a virtual cavity because you have to have another bone there, the nasal cavities, which are up inside your nose, and the paranasal sinuses, which are up here in our forehead, cheeks. So this shows you all the different cavities you would hit if you took a coronal section through this part of the skull. The orbit is a cavity, cranial cavity, oral cavity, nasal cavity, and then the sinuses are along here. Frontal sinus very small. You would see more of the frontal sinus if you moved more anteriorly. Okay, this shows you the difference between skull bones and facial bones. Each of the bones is color-coded here to make it more clear. What did I say I was going to? Oh, I was going to tell you about sutural or wormian bones. See this bone right here? It's not named because it's unique to this particular individual. So if you have lots of these, you'd have more bones as an adult than somebody else who doesn't have as many. They form during embryological development. Numerous bone markings. Canals are tubes of bone, not just a hole through a thin bone. A fissure is a crack. A foramina is plural, foramen singular. That's a hole in a thin bone. So if it's a tube, for example, there's a tube leading from the outer part of your ear to your eardrum. That is called a canal, external auditory canal. But if you had a thin bone, say like your jawbone or your scapula, if there's a hole in that, it'd be called a foramen, plural foramina. Latin has weird pluralization. Sutures, those are the lines that connect the skull bones. They're movable fibrous joints that form the boundaries between the cranial bones. Now, this is a little bit controversial because they're only immovable when you're not a baby. They're very flexible when you're first born. So there's a little bit of, and beware of this on the test. Remember, I told you this. So when you say, well, you never said, I can say, I'm telling you right now, there is some controversy about how much movement there is in suture. As an adult, there's no movement. As a newborn, lots of movement. So keep that in mind when you take the test when we talk about sutures. Dense, regular connective tissue seals cranial bones firmly together as suture. This will hold your skull bones together and form what are called the fontanelles in babies. Right up here, the soft spots. In adulthood, when cranial growth has stopped, the sutures fuse and are obliterated. There's no more sutures, especially in older people, about my age and older. Very difficult to see the sutures between the various skull bones. This is stuff I would ask my students who are taking this class on campus to know more of. These are some of the structures that you should know, bones and markings. So take a look at that. These are all kind of important. These show you the sutures here. Easy to see in a younger person, harder to see in an older person. So it's called coronal suture because it goes through the coronal plane. This is called the sagittal suture because the sagittal plane is in the center, or at least separating left from right. And the lambdoid suture is named after the Greek letter lambda, which is an upside down one. You can see these sutural or wormian bones in this individual. Some people have more, some people have less. There's the posterior view of the skull, showing you the sutures and the wormian bones and the different bones. Here's some more structures that you should know of the skull. These are what I test my students on who are taking the class, who do a lab exam on campus. So you should probably be happy that you don't need to know all these. You may need to know them for visible body, but taking it on campus is probably quite a bit harder than taking it online. Okay, more structures that my students taking it on campus would need to know. There's a lot. This is a big source of freak out for my on-campus students. This shows you the bones that hold the center of the skull together, the sphenoid, ethmoid, vomer, and palatine. There's another structure showing you the sphenoid, which looks kind of like a bird. It's the center of your skull. There's it from a different view. Okay, this is the ethmoid with the ethmoid sinuses. More about the ethmoid. This is the zygomatic, which is right there in the corner of your cheek. You can see it in green here. This is the vomer, or the perpendicular plate of the vomer, or vertical plate. This is what separates left and right nasal cavities. Palatine, which forms the posterior 1/3 of your hard palate. This is the maxilla, which is the roof of your mouth and the area just under your eyes. There's the medial view showing the maxilla. This is the mandible, which is our lower jaw, showing you some of the key structures there. These show you some key structures that you would see in a mid-sagittal section or cutting of the skull. These are the concha, or Latin for shell, which warm and moisten incoming air as you breathe in through your nose. Sinuses have a mucus lining that helps humidify and warm inhaled air. So it helps humidify and warm it so the air, when it gets to your lungs, isn't so cold and dry. One key thing is you want to think about is the fact that our vertebrae connects in the back of your skull. So everything sticking out from the back of your skull has to be held up by your neck muscles, and those can get sore. So one of the ways that your body has adapted, and all mammals that are set up this way have adapted, is trying to make the face lighter, because the more weight you have in the front away from the vertebrae, the more work those neck muscles have to do to hold your head up. So by having sinuses, it lightens up the bones of the face, making it easier to hold your head up. It also provides some resonance to the voice, so some depth, interest. Here's the image of some of the sinuses of the face. There's a lateral view. Notice that they're not exactly in the same orientation laterally and mid-sagittal. Here's some structures that are key. Eye socket. Auditory ossicles are what we call our inner ear bones. They're not really inner ear bones. They're middle ear bones. Interestingly, people often say, I have an inner ear infection. No, you don't. You have a middle ear infection, but having an inner ear infection is exceptionally rare. So these bones are the smallest bones in the human body. They're teeny tiny, little bitty things. Malleus, incus, and stapes. And their job is to transfer vibrations from your eardrum, tympana, to your cochlea, which is where the hair cells are that help you hear. The hyoid bone, which is the top of your larynx. It's a slender curved bone located inferior to the skull, between the mandible and the larynx, which is your top of your voice box. Now, here's one of the key things, interesting things about this I may ask you about. It's the only bone in the body that doesn't touch another bone. It's floating on top of this cartilage. So you know that old song, the leg bone's attached to the knee bone or whatever. This is the only bone that doesn't attach to any other bone. So that's what makes it so unusual. So in a skeleton, it's usually held up with just some wire because it's in the human body held up by cartilage. Serves as sites for attachment of tongue and laryngeal muscles and ligaments. They're showing you the hyoid and where it is. So if you feel your Adam's apple, the top edge of it is your hyoid bone. This is a fetal skull. Notice it has fontanelles, which are these soft spots made of connective tissue. What this does is allows the baby's head to deform during delivery, so it can come out of mom's birth canal successfully. In addition, it allows the skull to expand quickly as the skull and brain grow. And there's the soft spots that you see on top of a baby's skull. What are they? Fontanelles are regions between the cranial bones that are thickened, fibrous membrane remnants that are not yet ossified or turned into bone, sometimes called the soft spots. They close by approximately 15 months of age, depending on individual factors. When a baby travels through the birth canal, the cranial bones overlap at these fontanelles in order to ease the baby's passage, because a baby's skull is actually a little bit bigger than the birth canal. So by mushing and elongating, it allows them to get through with less stress. This is another reason why I generally don't recommend people take pictures of babies right when they come out of mom, because they look kind of like they've been preserved in a bag as a specimen, which is kind of what they've been, the bag, which is the uterus. They're much prettier. What was that?
I call them mashed potatoes.
Yeah, yeah. Babies are a lot prettier after a few hours or a day or so of the blood getting through their body, the hole in their heart closing. I don't know if you guys know, babies have holes in their hearts until after they're born.
They do?
Or about, yeah. We all had holes in our hearts before we were born. And that's one of the reasons why brand new babies look kind of blue, because the separation of deoxygenated and oxygenated blood is not complete when they first come out. Again, giving brand new babies not the most rosy hue to their skin. But we'll talk more about what happens with fetal and adult circulation pattern changes later when we get to the heart. So there you go. Okay, these are the different regions of the vertebrae. Cervical, the C lettering here, thoracic with a T. Now, what makes thoracic different from cervical? All the thoracic have ribs attached to them. That's what makes them thoracic. Every thoracic has a rib. Cervical have special, unique features. I'll show you. Lumbar are very thick and heavy because they're bearing the weight of the body. If you ever look at the trunk of a tree, it's thicker at the base than it is at the top because the weight is being held, greater weight being held at the bottom than at the top. Sacrum are fused vertebrae that fuse in fetal development. And then coccygeal vertebrae are called CO1 through CO4. So even though they both start with the letter C, the C by itself is given to the cervicals, and CO is coccygeal, sometimes called your tailbone. More about the vertebral column. It's composed of 26 bones, including 24 individual vertebrae and the fused vertebrae that form both the sacrum and coccyx. What is it for? It provides vertical support of the body, holds up your head, holds up the rest of your body. It transfers weight to the axial skeleton, and it protects the spinal cord of the brain, or at least the spinal cord when we're talking about the vertebral column by itself. There's a picture of a thoracic vertebrae. Now, how do I know for sure it's thoracic? Well, these little dents here are called rib facets. Remember, I told you if there's ribs associated with it, it's thoracic. So the ribs begin here, brace here, and then curve round to the rest of the body. So this would be in the back, curving round towards the front. This is called the body, or area where you'd find the intervertebral disc. These are lumbar, and notice they're much heavier, thicker vertebrae bearing more of the weight. You can see the intervertebral discs. In this case, the transverse processes are shorter and more solid. There's a lateral view of the lumbar. Now, reason why so many people tend to get problems with their lumbar vertebrae is because that's where all the weight of your body comes down. And if you don't line your spine up right, if you bend really far over, and then lift. What you're doing is you're putting a lot of pressure on the front and very little on the back, and that tends to make that intervertebral disc shoot out the back or rupture out the back. And that's why keeping a straight vertebrae when you're lifting is important. What are some spinal deformities? Well, kyphosis is an exaggerated thoracic curvature that is directed posteriorly, producing a hunchback. So I don't know if you've ever seen folks that look like hunching over. That's because the bodies of the thoracic vertebrae have compressed more than the anterior part is compressed more than the posterior part, making them hunched over. Lordosis is where the lower back is curved inward much more. And scoliosis is the only one that you can see from the back. And that's kind of an S-shaped to the vertebrae. And I had that as a kid, but it kind of sorted itself out. Scoliosis is the most common spinal curvature deformity. Most people don't need surgery for it. They wanted to give me surgery. My dad said no, and I'm glad he did, because that would have left me in a body cast for 6 months to a year. And I would have been an even bigger nerd than I already was. Anyway, scoliosis. There's a picture that one of my students brought in of scoliosis in the thoracic region. So that's kind of cool to see what it looks like in a X-ray. Okay, this is the atlas, which is the vertebrae that holds your skull up, the very first C1 vertebrae, showing you some of the key structures. This is the axis. Notice that the dens or odontoid process is the body of the atlas that's been transferred down to C2. That allows you to turn your head in a no motion. So you have atlas, axis, and then C3. The atlas and axis are the only two vertebrae that have specific names besides just numbers. So this is how they articulate. Notice that it allows rotation, so it allows your head to rotate left to right. Here's the sacrum. Notice the fused sacral vertebrae. In very, very primitive mammals and some lizards, this is not fused. They're separate vertebrae. Same with the coccygeal vertebrae. There's a posterior view showing you places where muscles attach and nerves come through. Okay, thoracic cage, which is our rib cage. It consists of the thoracic vertebrae posteriorly, which is our backbone, ribs laterally on the sides, and the sternum anteriorly up front. It's a protective cage around your heart, lungs, trachea, and esophagus. Provides attachment points for many muscles supporting the pectoral girdles, the chest, the neck, shoulders, the back, and muscles involved in respiration. There's a thoracic cage. Ribs. Ribs 1 to 7 are called true ribs because they have their own unique connection to the sternum. Ribs 8 to 12 are called false ribs because they piggyback on the connection for the true ribs. The last two are called floating ribs because they have no connection at all. So please note, the false ribs and floating ribs are all called false ribs, but floating ribs are the last two. And here's a rib showing you the different structures. Notice how it articulates. I showed you earlier how it articulates with the thoracic vertebrae. Okay. Any questions about that chapter? No? Okay. Okay, we're going to go through chapter 8 fairly quickly. My voice is failing. So I'm going to try to talk a little less and just show the slides. And if you have any questions, folks who are here, please let me know.
Tea and honey will help with your throat.
Lemon and honey, that's a good idea. That's a really good idea.
Or herbal tea and honey.
That is a great idea. I forgot to do that. I'm going to do that as soon as we're done. Okay, appendicular skeleton. Now we're talking about arms and legs and the girdles. So we got upper and lower limbs. Pectoral girdle is everything in your chest. Pelvic girdle, everything in your hips. Sorry, I'm going quickly, guys, but you guys can review this this presentation later on when I have it posted, and you can pause and fill in your notes as you need to. Pectoral girdle is your clavicle and scapula, attachment points for muscles, highly flexible. So this is your appendicular skeleton. Notice axial is grayed out or faded out. So everything associated with the arms and legs. Clavicle, don't worry about the yellow. These are things I normally ask in lab exams on campus. So this is your collarbone. Connects the manubrium, which is the top of your sternum, to the acromion of the scapula. Very commonly broken bone because it's not protected. And when you hit hard on your shoulder, it can crack that. Scapula, don't worry about the yellow here. This is called your shoulder blade. The acromion here articulates with the clavicle. Glenoid cavity is where your arm sits. It's the head of the humerus goes there. Body is the site of muscle attachment. A humerus, upper arm bone. You guys can read all that. Nothing much more to say there. This is your elbow joint. Posterior elbow joint. There's your upper arm bone or humerus, showing some key structures that you should know. This is the radius and ulna, lower arm bones. I'm going to let you read this. Okay, this shows you how the head and the radial notch articulate. This shows you the distal end of the arm, the wrist, hand bones. Carpals are the wrist bones. Metacarpals are the palms. So carpals are here, right where my watch is. And then the metacarpals are your palm. Hinge-like articulations. And in opposition, the ability to fold your thumb across like this is unique amongst humans. Other animals can't do it. This was just to show my students they need to know all the bones. Pelvis. The adult pelvis is made of 4 separate fused bones. Well, we're talking about 4 bones that can be separate. So it'd be the sacrum, the coccyx, and left and right os coxa. I'll show you what that means in a second. Texan supports the viscera and the inferior part of the ventral body cavity, so basically your hips area. Pelvic girdle, though, is just left and right os coxa, and I'll show you those. Okay, so this is your pelvis. One os coxa is this left side piece. The other os coxa is this right hand piece. There's your sacrum and coccyx. That's why they say 4. 1, 2, 3, 4. But please note that each of these os coxa are made up of 3 separate bones of their own. I'll show you that in a moment. Now, os coxa, sometimes called the hip bone or a nominate bone, is another name for the os coxa. So each of these os coxa is made up of an ilium, an ischium, and a pubis. Each coxa or os coxa articulates posteriorly with the sacrum, the sacroiliac joint, because it's sacrum and ilium, so sacroiliac. There's a picture of the sacrum showing you some of the key things I would ask my students to know. There's the medial view, same structure. Notice the 3 bones, ilium, ischium. You're sitting on your ischium right now, if you're sitting, and then the pubis is up front. This is showing you the difference between the pelvic inlet and outlet. Pelvic inlet is the top of the sacrum. The outlet is the bottom there, where the ischia are found. So you can see even better image of pelvic inlet, pelvic outlet. The sacrum is flattened in women, allowing the baby's head to pass, and in men it's more curved because they don't need to give birth. The pelvic brim, I'm going to let you read these. Not much to say other than what it says. There's a difference between male and female pelvises. It's the most reliable way to sex a skeleton. That means to determine gender. The greatest difference between male and female bones. Now, you can't say men are bigger bones, stronger bones. None of that will make sense. Bigger jaws, maybe. The only way really to get it is the pelvis. It has to do with the fact that women give birth, the baby goes through that pelvic canal, and men don't. So these are the differences, the main differences in the 2 genders. So you can see female pelvis more broadly arched here in the sciatic notch, more narrowly in men. So these are the main differences between male and female pelvises. Okay, femur. These are the upper leg bones. The head articulates with the acetabulum, which is part of your os coxa. These little bumps are muscle attachment sites. These are some structures you should know. The fovea is where a ligament attaches. There's some more structures that are part of the femur. Patella. Here's another interesting factor you guys might like is the only bone that you're not born with. Part of the reason why we can't walk when we're born is because we don't have a patella. That forms later on. Have you ever felt the knee of a newborn baby or a very young baby? They don't have a kneecap. That
They don't
forms
get
after they
kneecaps
start.
till 2 years old.
Yeah, I mean, about the time when babies start or toddlers start walking is when the patella starts forming, and that's one of the things that allows them to walk. It's a
Yeah,
redirection of the
it's not
force of the
fully
quadriceps.
formed till 2.
Yeah, so it's only very rudimentarily formed at birth, but not very easy to spot there. So that's another factor. What's the only bone that we have as adults that we're not born with? It's the patella. It's a sesamoid bone because it forms inside the tendon of the quadriceps muscle group. Tibia and fibula are lower leg bones. These are just some facts that are key to these bones. Knee joint, top of the tibia. More tibia and fibular interactions and structures. Foot bones. Tarsals are ankle and upper foot bones. Calcaneus is your heel. The talus is the big bone that actually articulates with your tibia. Metatarsals are the arch of your foot, and phalanges are toes. So phalanges are both fingers and toes. These are all the bones of the foot. There's an inferior view. Notice that there are some sesamoid bones similar to your kneecap that form in the flexor hallucis brevis tendons to help redirect the force around this joint so you have more power in your big toe for walking. Arches of the foot. The sole of the foot does not rest flat on the ground unless you are what is called flat-footed. Arches help support the weight of the body. Oh man, my voice. I'm gonna let you guys do this. There you go. So this is the medial longitudinal arch and the lateral one. So this is in the middle between your feet. This is on the outside edge of your foot. And then there's also a transverse arch when you look from front to back. Aging. What happens as we get older? Density declines. As we talked about, osteoporosis, erosion and porosity increase. Bones become more brittle and susceptible to fracture. This is usually due to a decrease in sex hormones, which do increase density of bones. The articulating surfaces can deteriorate, contributing to osteoarthritis. Changes happen from childhood and continue through life. So I may ask you an essay question that says, name all the changes that happen in the body from the time that you're a fetus up until you're old. And what you want to do is go through all the things that I talked about, all the changes that happen. And why is it worse in women? Because of, in older age, because of, what's the word I'm looking for? My brain just blanked. That happens sometimes, especially when you're sick. When you stop having your menstrual period. You guys know the word I'm looking for.
Menopause.
Menopause, thank you so much. So menopause means there's a pretty quick cutoff of the sex hormones, and that's when osteoporosis in women accelerates unless they take really active steps to stay active. Okay, that is it for today. I can answer a few questions for you, but I do appreciate Kiara and Kimberly, you coming to the lecture. I hope it helped being a part of it. Do either of you have any questions before we call it a day?
I'm good. I got no questions.
Kimberly?
No, I don't have any questions.
Okay. Well, be sure to send me any additional questions you may have to Canvas email. Remember, only use Canvas email. It's really important because if I need to reply to you and the rest of the class, I can't do that if you're sending it from your personal Yahoo or Gmail email. So please, all emails go through Canvas if you're talking to me. Okay, send me questions if you have them. Otherwise, best of luck with the rest of this week's module and the upcoming exams. You guys have a great rest of your week, and I hope to see you back here next week. Bye, guys.